Hi everyone. Our presentation is over Early Start Denver model, which is also known as naturalist intervention.
Hey y'all. So by the end of this presentation, you all can expect to understand what autism spectrum disorder is, understand the Early Start Denver model or naturalistic intervention, understand the relationship between autism spectrum disorder and naturalistic intervention. You all will be able to describe naturalistic intervention and describe the importance of evidence-based practice for children with autism spectrum disorder. So we'll start off with discussing evidence-based practice. So evidence-based practice, according to ASHA, is the integration of clinical expertise, external and internal evidence, and clinical, Lord, can I talk today? In client or patient perspectives. And so clinical expertise is basically the expertise of the clinician that are learned through experience um, with a particular topic or subject, while external data is going to be your literature review. Internal data is going to include anything particular to that particular patient or client that you're working with. So that'll be your internal evidence, while the client and patient perspectives are going to be the values and the things that are important to that particular client. It is important to use evidence-based practice with children with autism spectrum disorder because you want to make sure that they're getting the best possible treatment approaches to ensure a better quality of life for them.
All right, so according to the CDC, autism spectrum disorder is defined as a developmental disability caused by differences in the brain. People with autism often have problems with social communication and interaction and show restricted or repetitive behaviors or interest. There is an estimated 1 in 36 children have been identified with autism spectrum disorder. All right, some of the components of this intervention include that the Early Start Denver model is an evidence-based treatment approach for children with autism used to work on their language, cognition, and social development. The recommended age for this use of this intervention is 12 to 48 months or 2 to 4 years. It is a model that supports naturalistic play-based activities, which we know can be motivating for children. In this approach, parents are actively involved, and the treatment intervention is one of the few interventions that is appropriate for toddlers with autism. Some of the goals include increasing the child's communication to initiate, respond to, and continue social interactions, and increasing their attention to task and social situations. Next, we'll watch a video that talks about a little girl that is, she was diagnosed with PTSD and autism, and we will see what the Early Start Denver model looks like for her.
Did a lot of rocking. She could not deal with transitions whatsoever.
My initial impression was a little 2-year-old who was still developmentally in her infancy.
She couldn't get off the chair. She couldn't dress herself. She couldn't feed herself. She had no language. She didn't look at you. She was just beautiful and almost like a doll.
So she got diagnosed with level 3 autism, which is the highest form of autism that you can be diagnosed with. It's heartbreaking. You see this small child who is so scared and is so confused, and there's nothing you can do for them. We got a phone call, and it was from CTC, and they said that they're starting this new program called Early Start Denver Model, ESDM, and that they believe that Alea would be a fantastic client for them.
Our journey with ESDM started in 2015 when Dr. Nowicki told us about the research coming out of the Mind Institute. Children who participated in ESDM versus children who participated in regular autism treatments were showing a 60 to 70% improvement in their signs, whereas children with mild to moderate signs of autism were showing almost a complete reversal by the time they entered kindergarten.
She took off in this program.
Yay! Love it.
We wrote a collaborative grant to First 5 Yolo County. Krista and Sarah are the 2 ESDM certified therapists at CTC. Our goal is to have all our therapists certified.
When I was one, I sucked my thumb over the deep blue sea. I climbed aboard a pirate.
With ESDM, they just let her choose what she wanted to do, and then they would encourage it, and then they would encourage her to do a little bit more. And she did it.
Dot.
Look, I made a dice. Mommy, look what you made.
One of the really special things about ESDM is we have so much time with the family. In addition to our therapy time, we have parent training time.
This is an incredibly expensive program, but it's incredibly effective.
B for butterfly.
We have a 2 to a 3 hour session, and within that session, we're trying to reach an objective every 20 to 30 seconds.
No cup.
You trace the letter B.
Okay, I'm thirsty. So we're hitting expressive communication, receptive communication, but then we're also doing this joint attention where we're really trying to develop a relationship and find the smile. And while we're finding the smile, we're also remembering fine motor skills, gross motor skills, self-care. We're doing feeding skills.
Okay, so as you can see in the video, this intervention approach has been proven to be pretty effective for children with autism spectrum disorder. As you can see, Alea in the video, she was very severe when they first received her for treatment. She was not talking, was not even making eye contact with the person who was her caregiver. And then you see later on in the video, she is making sentences and making choices and expressively growing as well as receptive, having some receptive growth. And so that is just to show like how effective this treatment approach can be for children with autism spectrum disorder, no matter how severe or how unsevere or how low level autism they have. This approach can be very successful. So what does the literature say? So in our literature review, we actually came across a systematic review that showed pretty much what you just saw in that video, how this approach can be used to improve social interaction, communication, daily functioning, and play behavior. It was also reported in that same systematic review that they saw decreased problems in behavior, problematic behavior, and better relationship with the parent and child. And all of those things are demonstrated in our example in the video. You saw the child who was not communicating at all, who was hiding from a caregiver in the beginning, who was just very severe and off, began to become more social, began to make choices, began to have relationship with those around her. In addition to that systematic review, we reviewed a few other studies. One study showed that the Early Start Denver model again could also improve social withdrawal and hyperactivity in children with autism spectrum disorder. Additionally, another study we looked at showed that this approach can help with the development in all areas for a child, including social skills, speech skills, receptive communication, games, and household skills, again, as we saw in this video. So the literature very much so supports this intervention approach. Evidence of effectiveness. I mean, you guys just saw in that wonderful video, but I'll talk about it again. We came across another study that had 19 children, all within the ages of 1 to 4 years old, and all with autism spectrum disorder, that participated in a study using the Early Start Denver model for about 6 months in the year of 2020. And within that study, the following areas of growth were shown in different developmental areas. They were showing improvement with receptive communication skills. The children in this study improved their receptive communication skills by an average of 40%. They also improved in their ability to interact in games and social things like games. This increased to about 30%. Their cognitive skills increased to 30.5%, and then household skills also increased by 33%. So it's basically showing that this approach is very effective and it's been proven time and time again.
Okay. Some of the considerations for this approach would be that, as we know, early intervention can significantly influence a child's development. So the earlier the intervention, the better. Something else, it's fun and it's kid driven. As we saw the little girl in the video, she was motivated by playing dress up, by painting her mom a picture, all those things that can enhance her social communication and then just language overall. And then it could be done during daily routines, as we saw also in the video. Some of the challenges, however, are that it does require a lot of family support, which includes that big time commitment. And sometimes it could be anywhere from 15 to 25 hours a week that these kids go for intervention. Another challenge would be that it requires intensive training of the SLPs. So like I said, they were moving to have all their staff be trained. And so that's something that could be a challenge. And then another challenge would be that this program is expensive. So this little girl was able to get a grant, but that's one of the cons to this intervention.
So, in conclusion, autism spectrum disorder is a developmental disability that is caused by differences in the brain, and it is usually characterized by social challenges as well as the demonstration of restrictive and repetitive behaviors or interest in certain things. Um, and when it comes to the Early Start Denver model, this is a treatment approach that is based on applied behavior analysis. It encourages the use of play to build positive relationships with a child with autism spectrum disorder or any child. It has been used a lot as a tool to elicit growth in all areas of development for clients or children with autism spectrum disorder. And then lastly, what we discussed was evidence-based practice, and this includes a literature review, clinical expertise, and a patient's perspectives and values. It is important to engage these children with autism spectrum disorder, in evidence-based practice to ensure that they are receiving the treatment that will positively influence their quality of life. We hope you enjoyed, and these are our references. Thank you.